Okay, before we look at the terms proximal and distal, which are the most difficult of the terms we're looking at, let's just quickly make sure that we all understand the other terms. Like the term to say something is above or below would be superior is above and inferior is below. So the eyes are superior to the nose, or the mouth is inferior to the eyes. Hopefully superior, inferior makes sense. You can literally just replace the word in your mind with above or below, and if it makes sense, then that's a proper use of superior, inferior. Medial, lateral. With medial and lateral, the only tricky thing about that is that when you say that something is medial, what you mean is that you're comparing it against the midline of the body. So anything that's closest to midline is medial, and anything further away is lateral. Let's take a look at some examples. The nose is medial to the ear. The arm is lateral to the nipple. The thigh is medial to the palm. Hopefully that makes sense. So when you say something's medial, you're really comparing it from side to side, medial or lateral, that the two, are next to each other. Whatever's medial is closest to midline, and whatever is further away is lateral. Further away from midline is lateral. So I'll show you one tricky example that I've seen. The back of the thigh has three muscles that we refer to as the hamstrings. And so medial does not mean it's in the middle. In other words, this muscle is most medial, and this muscle would be most lateral. Hopefully that makes sense. Now with anterior posterior, we're saying that something is in front of or behind another. And so for instance, the eye is anterior to the brain. The spinal cord is posterior to the oral cavity. The thoracic cavity is anterior to the vertebral cavity. The vertebral column is posterior to the sternum. Hopefully those examples make sense. That's anterior, posterior. So on to proximal and distal. When you use the terms proximal and distal, you're comparing two things against a point of attachment. And so typically the terms proximal and distal are not used in the trunk. They can be used in the trunk, but you really have to know what you're talking about there, and I'll try to show you an example of that. But typically, we really have to be pretty proficient in terminology to use it there. Because if you are talking about an appendage, a limb, then there's a point of attachment. So let's take a look at the arm. The arm is attached at the shoulder. And so anything closer to that point of attachment is proximal. So the upper arm is proximal to the lower arm. The lower arm is distal to the upper arm. The elbow is proximal to the hand. The fingers are distal to the elbow. And sometimes, if you're looking at the hand, people wonder like, well, would I use that as the point of attachment? And you could, and you would still get the same answer. So do you see how, whether we're looking at the big point of attachment, the shoulder or the wrist, that the palm is proximal to the fingers. The fingers are distal to the wrist. So let me bring this up. Why couldn't I say the elbow is inferior to the shoulder? You could. And so that would be fine. Shoulder is superior to the elbow. The hand is inferior to the elbow. The palm is superior to the fingers. And so when you look at these, compare these structures in the arm and leg, you could use superior, inferior instead of proximal, distal. But when you use proximal, distal, the way that you use it is proximal is closest to the point of attachment and distal is further from the point of attachment. See if this makes sense. This is another example, but I'm going to look in the torso. Here I can see the gallbladder, and I can see where the gallbladder is attaching to the small intestine, that duct, And because that's the point of attachment, I would call that region of the organ proximal, and I would call this region of the organ distal. And that's the way that you could use terminology like that in this area. Typically, people use it on the limbs.